Neurologist warns, if your nails look like this after 60, your body may be hiding 4 diseases. Right now, before you allow any other thought to distract you, I want you to truly engage with a simple yet profound exercise. Hold up one of your hands, not for a fleeting glance, but for a deep, concentrated examination. Observe every curve, every shade, every subtle feature of your fingernails. This seemingly ordinary act holds the key to uncovering something extraordinary and critically important, a truth that most people over the age of 60 have never been explicitly told. It's a piece of diagnostic insight that cardiologists, immersed in the daily intricacies of heart health, utilize constantly but seldom articulate to their patients. Your fingernails are, in fact, silent, meticulous recorders, ceaselessly documenting the dynamic state of your heart and your intricate network of blood vessels. They have been diligently performing this function, without fanfare or conscious acknowledgement, throughout the entirety of your life. And if you possess the specific knowledge of precisely what visual cues to seek, these small, often overlooked appendages can serve as an invaluable early warning system, signaling an impending cardiovascular crisis long before it escalates into an emergency. I am Dr. Mandell, and a significant portion of my professional life has been devoted to the challenging and incredibly rewarding field of preventative cardiovascular care, particularly for individuals in the over 60 demographic. Over these many years, I have encountered a disturbing pattern in my clinic, an observation that genuinely troubles and motivates me. Far too often, patients arrive in my office having just suffered a heart attack or a stroke, incidents that irrevocably alter their lives. Yet, upon a meticulous and informed examination, it becomes heartbreakingly evident that the warning signs, the silent harbingers of these devastating events, were already present on their fingernails. Sometimes, these crucial indicators had been visible for months, even years, preceding the actual cardiac or cerebrovascular event. The tragic reality is that nobody had noticed these subtle changes, and more importantly, nobody had empowered these individuals with the knowledge of what to look for. That pervasive gap in understanding, that silence around such vital information, must end today. I urge you to stay with me until the very end of this discussion, because the final sign I will unveil is one that consistently leaves most people utterly shocked by its implications and its overlooked significance. Before we delve deeper into these specific signs, I have a simple request that can significantly impact not only your understanding, but potentially the reach of this life-saving information. I invite you to share your age in the comments below, and importantly, disclose whether anyone in your immediate family has ever experienced a heart attack or a stroke. Your candid response will provide a personal context, shaping the urgency with which you need to absorb and apply the critical insights we are about to explore. Furthermore, if you find this kind of empowering, health-focused content valuable and helpful, please take a moment to hit the like button. This small action genuinely assists me in extending the reach of this crucial information to a wider audience, ensuring it reaches more individuals who desperately need to understand these hidden signals from their own bodies. To truly grasp the profound reason why your nails are such extraordinary carriers of this vital cardiovascular information, it is essential to understand a fundamental piece of human biology. Your nails do not simply materialize. They originate from a specialized structure known as the nail matrix, which is strategically positioned just beneath the protective skin fold at the base of each nail. The cells within this matrix are in direct, continuous, and intimate contact with your bloodstream. They are sustained and nourished by the most incredibly delicate and smallest blood vessels in your entire body, the intricate network of capillaries that weave their way directly beneath your nail bed. Because these microvessels are so remarkably minute, so exquisitely fine, they are among the very first physiological structures to register and manifest signs of stress when your overarching cardiovascular system begins to falter or struggle. Therefore, you can conceive of your nails not merely as cosmetic features, but as a live, constantly updating physiological monitor that your body has been quietly yet tirelessly running every single day of your existence. The significance of these subtle nail changes becomes exponentially more critical as we cross the threshold of 60 years of age. In our younger years, perhaps in our 30s or 40s, the body possesses a remarkable capacity to compensate for early cardiovascular problems. The heart can subtly adjust, working around minor dysfunctions for years, often without producing any visible or discernible symptoms. Our physiological reserves are robust, capable of masking underlying issues. However, after the age of 60, these reserves thin considerably. The body's ability to silently compensate for cardiovascular strain diminishes significantly, meaning that warning signals, once easily hidden, begin to appear earlier and with greater clarity. And strikingly, your nails are frequently the very first place where these crucial indicators manifest. The inherent challenge within our modern healthcare system is that a typical 15-minute doctor's appointment, often constrained by time and immediate symptoms, cannot realistically cover every potential diagnostic avenue. A thorough nail examination, unless something is overtly and visually alarming, rarely makes it onto the priority list. Consequently, while this vital information exists within the realm of medical research and specialized cardiology, it frequently fails to reach the person sitting at home, the individual who actually needs it most to protect their own health. That critical information gap between specialized knowledge and public awareness is precisely what I am committed to closing for you today. The first significant sign I want to guide you through is known as Terry's nails. This specific term may not resonate as familiar to most people, existing largely within medical discourse. However, once you understand its characteristics and implications, I assure you, you will observe every pair of hands, your own included, with a newly informed perspective. Terry's nails manifest when the entire surface of the nail transforms into an opaque, whitish, or exceptionally pale coloration. This appearance is often likened to frosted glass, possessing a translucent yet muted quality. The defining characteristic, the crucial feature that separates Terry's nails from simply pale nails, is located at the very distal tip. There, you will observe a narrow, distinct strip of pink or reddish color, typically spanning just a few millimeters in width, forming a stark contrast to the rest of the nail plate. This vibrant band at the edge is the bare, unequivocal marker. Now, let's explore why this particular nail presentation holds such profound importance for the health of your heart. Extensive research, meticulously published in leading journals of cardiovascular medicine, has unequivocally identified Terry's nails as significantly associated with the presence of coronary artery disease, congestive heart failure, and diabetes. To put this into a more striking perspective, one comprehensive study found that individuals exhibiting Terry's nails had an odds ratio exceeding 6 for coronary artery disease when compared to individuals without this distinctive nail pattern. This is far from a minor statistical detail. It constitutes a major, undeniable signal. Crucially, all of the serious conditions linked to Terry's nails share a common, perilous characteristic. They tend to develop slowly and silently over a period of years, often without producing any dramatic or overtly alarming symptoms until they reach an advanced stage. Consider the case of a patient I'll call George, who came to see me when he was 71 years old. He arrived without any dramatic or pressing complaints, generally feeling reasonably well for his age. He did, however, mention being a little more tired than usual, a symptom he quite naturally attributed to the inevitable process of aging. During the course of his examination, as I routinely observed his hands, I immediately noticed the unusually pale appearance of his nails, distinctly marked by that characteristic reddish strip at the tip, the classic presentation of Terry's nails. This observation prompted me to ask a series of more careful, targeted questions about his energy levels, any minor exertional symptoms, and his general health history. Following this, I ordered an echocardiogram, a non-invasive diagnostic test that provides detailed images of the heart's structure and function. The result was profoundly revealing. George was in the early stages of heart failure, a condition that had been silently developing for nearly 2 years without any obvious attention-grabbing symptoms. His subtle fatigue was, in retrospect, his body's quiet plea. George is doing remarkably well today, having received the right treatment at the right time, preventing a much more severe progression of his condition. His nails were not merely an aesthetic feature, they were the crucial doorway that opened a conversation, leading to a life-changing diagnosis and timely intervention. The second distinctive sign we must explore is known as Lindsay's nails, sometimes more descriptively referred to as half-and-half nails. This presentation possesses a very particular and unmistakable appearance that you will immediately recognize once you are made aware of it. In Lindsay's nails, the nail plate is visibly divided into two distinct, sharply delineated zones. The half of the nail closest to your cuticle, the proximal portion, exhibits a white or very pale coloration. In stark contrast, the half of the nail closest to the tip, the distal portion, displays a brownish-red hue. The boundary separating these two zones is typically quite sharp, clear, and unblurred, making the distinction visually striking. Clinical research has associated Lindsay's nails with both heart failure and with liver cirrhosis, indicating that they tend to appear after the body has been subjected to sustained and significant circulatory stress for an extended period. I purposefully include both Terry's nails and Lindsay's nails early in this critical discussion because they are both fundamentally disorders of nail bed color that serve as direct reflections of how effectively blood is actually reaching and nourishing the smallest, most distal tissues in your body. When the intricate microcirculation to the fingertips is compromised over a sustained duration, the nail bed, deprived of adequate oxygenated blood flow, gradually loses its normal, healthy pinkish coloration. In its place, these distinctively altered patterns emerge, providing a visible testament to underlying systemic issues. Both of these crucial signs are readily visible in ordinary daylight, requiring no special equipment or advanced medical tools. If you simply hold your hand under good natural light right now and carefully scrutinize each of your nails, you can check for both Terry's and Lindsay's nails in less than 30 seconds. I urge you to perform this quick self-assessment now, while these detailed descriptions are still fresh and vivid in your mind. The third crucial sign to recognize is called Mises lines. These manifest as multiple, distinct horizontal white lines that traverse the nail plate, running parallel to the lunula, the small, whitish crescent-shaped area typically visible at the base of your nail. A key characteristic that helps differentiate Mises lines from other types of nail ridges or irregularities is that they do not feel raised when you run your finger over them. While you can clearly perceive them visually, your fingertip will not detect any textural alteration on the nail surface. They are exclusively a visual signal, not a tactile one. What renders Mises lines particularly significant and worthy of your attention is the robust scientific research that underpins their clinical importance. A comprehensive study specifically investigating the relationship between various nail mold findings and cardiovascular disease discovered that Mises lines were a statistically significant predictor of heart failure, presenting with an impressive odds ratio approaching 6. This finding means that the observed presence of these distinctive lines on a patient's nails made the diagnosis of heart failure substantially more likely. The underlying physiological reason for the appearance of Mises lines is that they reflect chronically low albumin levels in the blood. Albumin is a critical protein produced by the liver, essential for maintaining fluid balance and transporting substances throughout the body. Low albumin levels are a well-established marker, signaling that the body is under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently, the entire systemic network, including the most remote tissues, inevitably begins to feel the strain and reflect it. I recall a patient named Margaret, who came to see me at the age of 68. Margaret was an active individual, maintained a healthy weight, and genuinely felt that she was in excellent health, with no specific complaints. During her visit, she mentioned almost as an afterthought, a casual observation that she had noticed some faint horizontal lines on her nails over the past few months. She had logically, but mistakenly, dismissed them as probably nothing significant. However, as I carefully examined her hands, I recognized the unmistakable pattern of Mises lines across several of her fingernails. This visual cue prompted me to order a comprehensive cardiovascular workup, despite her lack of overt symptoms. The tests revealed early-stage heart failure, a condition that, importantly, was entirely manageable at that specific stage of its development. The lines, which Margaret had noticed for months, were her body's subtle, persistent way of asking for help, a silent cry for attention that, thankfully, I was equipped to interpret. The fourth vital sign we will cover is known as Bow's lines, and this particular indicator tells a markedly different story compared to the others we have discussed. Whereas most nail signs tend to accumulate gradually over time, reflecting chronic and slowly developing conditions, Bow's lines appear specifically after a distinct and often significant physiological event. They manifest as deep horizontal grooves or depressions that run across the nail plate. The mechanism behind their formation is a temporary yet profound interruption in nail growth. When the body undergoes a significant physiological shock, whether it's a severe heart attack, a major cardiac surgery, a profound systemic infection, or any other critical health crisis, the nail matrix temporarily halts or significantly slows its production of new nail tissue. When normal nail growth eventually resumes, this period of arrested development leaves a visible groove or depression behind in the nail plate. What renders Bow's lines clinically indispensable is their ability to reveal a past cardiac event that the patient themselves may not have consciously recognized or even attributed to a heart problem. Silent heart attacks, those occurring without the classic, dramatic chest pain symptoms, are far more common than most people realize, particularly within the older adult population, making these retrospective markers incredibly valuable. I recall a patient named Harold who visited my clinic for an ailment entirely unrelated to his heart. As I conducted a general examination, I couldn't help but notice a distinct, clear, horizontal groove etched across nearly all of his fingernails. This prominent visual cue immediately prompted me to inquire about it. After a moment of thoughtful recollection, Harold recalled being very seriously ill approximately 4 months prior, an illness he had simply assumed was an unusually severe bout of the flu. Based on the presence of his Bow's lines and his account, we proceeded to run a series of diagnostic tests. These investigations unequivocally revealed that he had in fact experienced a silent heart attack during that period of severe illness. His Bow's lines, etched into his nails, told a powerful and undeniable story that his symptoms alone had failed to convey, allowing us to implement crucial preventative measures for his future cardiac health. Now, I want to shift our focus to something you can inspect directly underneath the nail surface, rather than on the top. These are called splinter hemorrhages, and their appearance is precisely as their name suggests. They look like tiny, dark splinters or thin, dark lines running vertically beneath the nail plate. These are, in fact, small collections of blood that have leaked from damaged capillaries and become trapped within the delicate nail bed. While the occasional, isolated splinter hemorrhage caused by accidentally bumping your hand against something is generally not a cause for concern, the presence of multiple, unexplained splinter hemorrhages distributed across several fingers is an entirely different and much more serious matter. Classically, in comprehensive medical training, the finding of unexplained splinter hemorrhages across multiple nails is strongly associated with infective endocarditis. This is a severe and potentially life-threatening infection of the inner lining of the heart's chambers and valves. This dangerous condition typically develops when bacteria, often originating from another part of the body, enter the bloodstream and subsequently attach themselves to previously damaged heart tissue. The infection process causes tiny, infected clots to break off from the heart valves and travel through the bloodstream to distant blood vessels, including the incredibly tiny capillaries nestled within your nail bed, where they become visible as these characteristic hemorrhages. Infective endocarditis is a grave condition that demands immediate and urgent medical attention, as delays can lead to irreversible heart damage or systemic complications. A patient I'll call Phyllis noticed these perplexing dark lines on several of her nails and mentioned them to me almost as an afterthought during an appointment, initially considering them insignificant. Her casual mention, however, prompted a thorough investigation, leading to a diagnosis of a heart valve infection. Crucially, the infection was caught precisely in time to be treated effectively with antibiotics, preventing severe, irreversible damage. She later confided in me that she had almost decided not to mention the lines at all, so convinced was she that they were nothing. This illustrates how easily critical clues can be dismissed without the right knowledge. If this video has proven useful and insightful to you so far, I want to reiterate a request before we continue. Please take 1 second right now to hit the like button. It genuinely makes a significant difference in ensuring this vital content reaches others who are in need of this information. And please, stay with me, because the next 2 signs we will explore are the ones I want you to regard with the utmost seriousness. The small, whitish, often crescent-shaped area visible at the base of each nail is known as the lunula. Most people tend to perceive it as merely a cosmetic feature, an aesthetic detail. However, the lunula is in fact the visible portion of your nail matrix, the highly active zone where new nail cells are being continuously formed around the clock. Consequently, the color and appearance of your lunula represent one of the most frequently overlooked yet diagnostically significant signals on the entire human body. When the color of this vital area changes, it is an unequivocal call for your attentive observation. Research has conclusively found that a reddish lunula is significantly associated with valvular heart disease and with congestive heart failure, indicating underlying cardiac strain. Conversely, a bluish or purplish lunula often suggests problems with oxygen delivery within the circulation, a phenomenon akin to the cyanosis we observe in more advanced stages of cardiovascular disease, signifying insufficient oxygenation of tissues. Furthermore, a lunula that has faded to almost nothing, becoming exceptionally pale or nearly invisible, is frequently a sign of anemia. Anemia itself is directly and intrinsically connected to cardiovascular strain because an anemic heart is compelled to work significantly harder and more inefficiently to compensate for the reduced oxygen-carrying capacity of the blood. All 3 of these distinct color changes, reddish, bluish-purplish, or faded pale, deserve prompt medical attention and thorough evaluation. Allow me to share the story of a patient named Dorothy, a 74-year-old woman who contacted me after her daughter, who happened to be a nurse, noticed during a visit that the half-moon shapes on Dorothy's nails had almost entirely vanished. Dorothy herself had not perceived this significant change because it had occurred so slowly and insidiously over time. Like many people, she had been looking at her own nails every day, gradually adjusting to the new normal, without consciously realizing that anything had profoundly shifted. Her observant daughter, however, encouraged her to bring this specific observation to her next medical appointment. We subsequently performed a complete blood count and a comprehensive cardiovascular workup. The results revealed that Dorothy was significantly anemic and was, simultaneously, exhibiting clear signs of early cardiovascular strain. Both issues were identified and successfully treated before anything serious or irreversible could develop, a testament to the power of informed observation and early intervention. Now, let me empower you with a simple yet profoundly insightful test that you can perform on yourself right now, requiring nothing more than your own 2 hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels, those vital microcirculatory networks, recover and reperfuse after being subjected to brief pressure. Here is precisely how you perform it. First, hold your hand at the level of your heart. Then, use the thumb of your opposite hand to press firmly on one of your fingernails for approximately 2 seconds. As you apply pressure, you will observe the nail bed blanching, turning pale or white as the blood is temporarily pushed out of the capillaries. Immediately after releasing the pressure, begin counting quietly in your head. In a healthy adult with robust, efficient circulation, the normal pink color should return to the nail bed in under 2 seconds. If, however, it consistently takes 3 seconds or longer for the color to return, and you obtain the same slow result when you test 3 or 4 different fingers, this is a meaningful and clinically significant sign that your microvascular circulation is sluggish and potentially compromised. Extensive research has linked persistent, slow capillary refill in older adults to several serious underlying conditions, including reduced cardiac output, undiagnosed atrial fibrillation, and an elevated risk of stroke. I strongly encourage you to try this simple yet powerful test right now before you conclude watching this video. Ensure you perform it in a warm room with warm hands, as cold temperatures can constrict blood vessels and artificially distort the result. I remember a patient named Walter who, after hearing about this test, decided to try it one evening. He counted nearly 5 seconds before the color returned to his index finger. Intrigued and slightly concerned, he then tested his thumb, followed by his middle finger, and subsequently repeated the process on the fingers of his other hand. Each time, he obtained the same consistently slow result. The following morning, Walter promptly called my office and described precisely what he had observed. A full diagnostic workup was initiated, which revealed undiagnosed atrial fibrillation, a prevalent and particularly dangerous form of irregular heartbeat that is one of the most common and significant causes of stroke in adults over 60. He was immediately placed on appropriate medical treatment, and according to everything we understand from current cardiology literature and clinical experience, that timely phone call, prompted by his observant self-test, very likely prevented a major, debilitating stroke within the subsequent year. Crucially, Walter had absolutely no other noticeable symptoms at the time, underscoring the silent and insidious nature of such conditions. Now let me provide you with a practical and actionable framework for how to integrate all of this critical information into your routine. I want you to commit to starting today, not next week, not at your vaguely scheduled next appointment, but right now. Take both of your hands to a window where you can benefit from good, natural daylight. Begin by looking at each nail, one at a time, with focused attention. First, meticulously check the color of the nail bed for any discernible bluish, purplish, or unusual pallor. Next, scrutinize the very tip of each nail for that characteristic reddish band that specifically signals the presence of Terry's nails. Then, look for any horizontal white lines across the nail that you can clearly see but cannot feel with your fingertip, which could indicate Mises lines. Subsequently, check for any deep, distinct horizontal grooves or depressions that might be indicative of Bose lines, signaling a past physiological event. Carefully look for any tiny, dark lines or splinters beneath the nail surface that have appeared without any obvious trauma or injury, which may be splinter hemorrhages. Examine the base of each nail for the lunula, that small crescent, paying close attention to its color and its approximate size. Finally, perform the capillary refill test on at least 3 different fingers and be scrupulously honest with yourself as you count the seconds. The next step is perhaps even more crucial than most people realize. Write down precisely what you find. This documentation step is vital because these subtle changes are inherently slow and gradual, developing imperceptibly over extended periods. Human memory, unfortunately, is notoriously unreliable and prone to distortion when recalling such subtle incremental shifts over months and years. A clear, well-lit photograph of your hands, taken today in natural light, provides you with something concrete, objective, and honest to compare against 6 months or a year from now. If, upon your initial self-examination, you observe even one of these signs, make a point to mention it specifically at your next routine medical appointment. However, if you detect 2 or more of these signs together, do not wait for your annual checkup. This warrants a more urgent approach. Call your doctor's office this week, describe precisely what you have observed, and explicitly ask whether you need to be evaluated sooner than your scheduled appointment. One final, incredibly important caveat before I conclude. Please do not use any of this valuable information to self-diagnose. That is not its purpose. What these signs powerfully do is furnish you with a compelling reason and the specific language to initiate a precise, informed, and targeted conversation with your doctor. An accurate diagnosis is a complex process, derived from a holistic understanding of the full clinical picture, your complete medical history, your current medications, any other symptoms you might be experiencing, and a thorough professional examination. Your fundamental role, as an empowered individual, is not to diagnose. Your crucial job is to notice, to document these subtle changes diligently, and most importantly, to speak up. That proactive step of bringing observations to your doctor's attention is the part that most people never do, and it is precisely the part that makes all the difference in safeguarding your health and potentially your life. Your fingernails have been sitting quietly at the end of lie,